Assalamu alaikum. I'm Dr. Ahmed, working in healthcare system Oman. Earlier, I have made a video on Brunei Darussalam, a detailed video where you can see how you can apply to Brunei Darussalam and what is the time period or time frame required to get a job there. Today, I will briefly talk about the interview which took place for me in, I think it was in April 2023. So I will 100% explain how it went for me, how they started the interview, what were the points they asked me in the interview, and how many people were there, and what were their cadres. So let's get into the video. So there were two people. One was from the ministry, they are a government official from the HR department of Ministry of Health, Brunei Darussalam, and another one was a gastroenterologist, because my interview was related to gastroenterology post. So another one was gastroenterologist. So there will be a doctor which will be related to your field. So two people will be there getting your interview. First of all, they will send you an email and time, and the time frame. You should know that what is the time difference between your country and in Brunei Darussalam, and according to their time you will be ready to give your interview on Google Meetings. So set your lighting, set your internet properly, have a backup internet ready, because this can be a problem at the time of interview. Maybe the internet is not working or something like this. So you should have two sources of internet at the time of your interview already set, with the good lighting and a noise-free room also. Try to keep your children out of that room at that time. Secondly, you should be sitting there. If they are late, maybe 10 minutes, they were late for me for 10 minutes, so they contacted me on my WhatsApp number. So I was very happy to see that they're concerned, and they texted me that we are sorry, we will be with you shortly in 10 minutes, because we are conducting an interview with another candidate. So that was a good gesture from them. So my interview started almost 10 minutes late. And first, the lady was from ministry. She started first. They introduced themselves. She was from the human resources, and Dr. Saab was a gastroenterologist working in a tertiary care hospital in Brunei Darussalam at that time. So first, they asked me to introduce yourself. So my introduction was brief. I told them my name, where I was living, and where I didn't start my education from the primary school. I started it from the med school. So I told them that I completed my MBBS degree from one of the prestigious institution of Pakistan, which is Islamic Medical College, and then I did my internship, 1 year house job from Jinnah Hospital, Lahore. And after that, I told them all my my medical career. I didn't stop. I told them this was actually my introduction, obviously my medical introduction. They didn't wanted my personality or personal introduction, like the personal things. They obviously, when you are in a professional interview, they want to know you through your professional background. So I told them that I have worked wherever I have worked in a sequential manner. So when I explained all my experience, then I told them that after my internship, I had a 1 year experience as a medical officer in a basic health unit, and later on I appeared for entrance exams to post-graduation degree, and then I entered a post-graduation training in gastroenterology and hepatology, where I worked 2 years in internal medicine and then 3 years in gastroenterology, where they ask what were your duties in internal medicine and what were your duties in gastroenterology unit. I told them that in internal medicine I used to handle patients in OPD, in indoor, and in emergency as well on rotational basis. We usually had two emergencies per week, two emergency duties per week, two OPDs per week, and rest of the days we were in indoor department looking after for our patients. And when I entered the gastroenterology training after 2 years, we used to do gastroenterology and hepatology OPD once in a week, or once or twice in a week, and then rotation in endoscopy suite, where we used to do endoscopy and colonoscopies and observe ERCPs as well. And we also did and then I told them about my procedures. Okay, so you can do it according to your specialty, whatever you did in your training, and also the indoor patients as well. So next, they asked me about where are you working now. So at that time, I was working in an Indus hospital, Julietown campus, which is a new campus in Lahore. So I told them I'm working as a senior medical officer there, and my duties are to look for my duties are on rotational basis in emergency, in OPD, and in indoor. And I also looked after for ICU patients at that time in Indus hospital. I also told them I was doing another job in ICU care of Sarah Memorial Hospital. I also told them about that. And yeah, and their more focus later on, their more focus was on what are my duties in Indus hospital. Okay, because that was my recent place of job. So they asked me about what kind of patient you usually get, what kind of how do you do your procedures, how many procedures you do very often, what kind of procedures are routinely you are familiar with, and what procedures can you do comfortably. And then they said, okay, here you will be doing the procedures under observation, and you will be handling the patients of gastroenterology, but you will also do few duties in medicine as well, like a few on-call duties. So I told them, okay, I have no problem doing on-call duties in medicine, because I have already, because our unit in Genoa hospital, the gastroenterology unit is actually affiliated with the medical unit. So there wasn't a problem for me, and at doing such duties. And after that, this goes on for almost 20 minutes, I think, the introductory part, the everything about me, about my medical career. And they also asked about my internship rotations as well. So after that, Dr. Saab, he was a gastroenterologist. He asked me two questions. Okay, so it was actually a scenario. He said a patient comes to you, 45 years old, a female with pain epigastrium. Okay, severe pain epigastrium. So I started the history from the vital signs, and then I asked about the character of the pain and all the pain history. He told that the pain is radiating from the back, it is associated with nausea and vomiting. So my first DD was, I said it could be acute pancreatitis, and then secondly it could be gastritis. There was no loose motion, so I didn't say gastroenteritis. So then he asked, how will you proceed? I have as in an investigation point of view. So I told him we will do basic baseline investigations, including amylase and lipase. So he said amylase and lipase are raised. So it was a case of acute pancreatitis. How will you manage? A simple management initially, and then obviously you will get a CT scan and proceed accordingly. And later he said, okay, if the same patient comes to you with normal amylase and lipase, and there is vomiting and pain epigastrium, but pain is not radiating to back, what can it be? Obviously it was a gastritis. So he said, okay, what is the most common cause of gastritis? What if you want to investigate the gastritis, what will be your first choice of test? So the most common cause is obviously H pylori, We do non-invasive testing like stool for H. pylori antigen, and invasive testing we have endoscopy. And yeah, this was almost all. Obviously initially we will give PPI, and this was I mean to say that very simple, very related to your specialty questions they will ask from you, and only maybe two scenarios, that's it. That part was not long. It was almost 6 to 7 minutes, maybe 10 minutes maximum. So total interview was around 30 minutes, and most of its part was related to your job, your job description. Later on, after that, they sent email to my my references, which was my supervisor and my another senior from Indus Hospital. And after that, they contacted me for my job position. So this was all about the interview. It wasn't a big deal. I don't think so. You should prepare a lot or have attention. Like, just keep calm, have a cool mind at that time, and nothing is there gonna be which is out of the context, which is like uh, a surprise to you. Yes, they may also ask a question, why do you want to work in Brunei Darussalam? Okay, yes, they asked me as well. I said I have always wanted to work in a prestigious and a very diverse kind of healthcare system, which is very advanced. And Brunei is have a very advanced medical education system, so that's why I wanted to enter it. And also I wanted to work in exotic and beautiful places with the beautiful landscapes like Brunei Darussalam. And I wanted an international exposure. And also, to be honest, I want Brunei is offering more salary than any other country. That's why I chose Brunei. That was my honest answer to them. And later on, they also asked, okay, what do you want? Is there anything you want to ask from us? That was their question. So I asked them, okay, how much salary am I expecting? So they said, right now we cannot disclose, but after we select you, we will send you an offer letter and everything will be explained in that. After that, I also asked how much time will it take you to reply me about this interview. They said, we cannot say for sure, and we will sort out your CV and your interview, and then we will see when we get back to you. So they were not clear about that either. So yes, that's what the interview. I hope this will help you, and try to calm, try to relax. No need to prepare and do anything, because they will ask you very simple common scenarios, and you just have to proceed according to the guidelines, the way you manage your patients. Start from the baseline, start from the vital signs, stability of the patient, if the patient is stable or not. Look and see if the patient is an OPD case or an emergency case, and proceed accordingly. Okay, if it's OPD case, obviously start with the history, start with the examination points, and then go for the investigations, and then DDs, and then management plans. So that's it. I hope this will help you in finding a good match in Brunei Darussalam. Thank you so much.